welcome to my channel. My name is Jazzy RN. If you're new here, welcome. If you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. And just a little bit of FYI about my background. I have over 9 years experience in utilization review, also known as utilization management or clinical review. And I've worked for 3 different major insurance companies. The goal of my channel is to help nurses pivot from the bedside to remote work. This company is Brighton Health Plan Solutions. The current job opening is a workers' compensation nurse case manager. It is full-time and is also for experienced nurses. Now, I always go straight to the qualifications, but even if you don't meet every qualification, I still suggest you apply. You must be a current licensed RN in the state of New York, or the ability to obtain a New York license, maintain current licensure and specialty certifications that's relevant to the position. A CCM is encouraged. At least 1 year experience in workers' compensation case management, bachelor's degree preferred. At least 4 years experience in clinical environment that's required. That's basically the bedside. Strong skills in medical assessment or medical record review. I'm going to skip some of these bullet points, but I will focus on this one regarding Microsoft Office. Make sure your resume includes platforms. That's Microsoft Office, Cerner, Epic, Meditech, Protouch, etc. Whatever software or platforms you currently use at your current job and the ones at your previous job as well, you want to add that to your resume to make your resume more marketable on the tech side. Next company is Oregon Health. This position available is an RN utilization management. It is full-time. It is available in 9 locations. That includes Oregon, Utah, Texas, Idaho, Wisconsin, Montana, Nevada, Washington, Arizona. The pay rate for this job is $100,000, $222,000 per year. Also a bonus SIP target, 5% annual. You must have a current unrestricted Oregon RN license, 2 years RN experience, or 1 year RN experience and 3 years experience in healthcare setting role, such as billing, coding, medical assistant. Preferred experience include more than 1 year RN experience, healthcare utilization management experience, and a functional focus of appeals and grievances, benefits review or benefit management, and experience with Medicaid or Medicare utilization management. This is preferred. This is not required. Henry Ford Health is hiring an RN coordinator, Payor Audit, full-time days. Requirements include 3 to 5 years of clinical experience, that's the bedside, a BS in nursing that's required, or 3 years of denial or appeal or utilization management experience. Knowledge of hospital billing and payer regulations, including criteria for patient status determination and tools or software used for determination. Now, they don't mention if they're using Interqual or MCG for this position, but if you go to the description box below, you'll see a link. This link will take you to a site called Cure the Bedside Burnout. Now, on this site is a list of over 90 companies that hires nurses to work remotely. The majority of these companies are for nurses in the US working for US companies, but there are some companies on here that allow you to, if you live in, let's say, Australia or Canada, the Philippines, etc., you can actually work for companies who are based in those countries as a remote nurse. And every single list of these companies has a link that goes straight to either the LinkedIn page or the company's career page. If you go to the very top of the screen, you'll see resume tips. If you click on that, that will take you to a different screen. And that screen has a list of information regarding how to format your resume, what to look out for, what to actually put on your resume, as well as where to go to get Interqual and MCG certification. And just FYI, I'm not being paid to promote MCG or Interqual certification. It's just an option for you to make your resume more marketable. And also this job requires you to have a Michigan license. Cadence is hiring an RN supervisor alerts evenings. This job requires you to work from 3 p.m. to 11 p.m. weekdays, 5 years experience as an RN, active unencumbered compact RN license required, at least 1 year of supervisory or management experience in triage, remote patient monitoring, or high volume call or queue-based environments, experience in ICU, triage, urgent care, or other high acuity settings with demonstrated ability to manage medically complex patients with chronic conditions. I'm going to skip these bullet points, and this job does not include the salary. Next position is an RN APCM California license required. This is a weekday position, and you'll work from 8 a.m. to 5 p.m. Pacific time. Of course, you must have an RN license for the state of California, and they want you to have a compact state license. Associate's degree in nursing, 5 years of recent clinical experience as an RN in an ICU or ER, that's preferred, not required. Prior experience supporting patients in the chronic care management program is a plus. I'm going to skip some of these bullet points, and right here where it says EMR experience, make sure you add the platform to your resume. That's Epic, Athena if you know it, Cerner, etc. And the salary for this role is $80,000 to $90,000 per year. Banner Health is hiring an RN medical management services. This job is full-time and remote for Arizona. The pay is $35.43 to $59.05. You'll work weekdays from 8 a.m. to 5 p.m., including Saturday rotations. This is normal to work rotations on the holidays and weekends, and you must reside in the state of Arizona. Now this one right here where it says for your requirements or qualifications, they want you to be an RN licensed in the state of practice, but earlier did mention you must live in the state of Arizona. Your all license or certification must identify the issuing state or entity, a BSN or equivalent experience, proficiency level type typically achieved with 5 years of clinical experience. I'm going to skip this paragraph, and if you have any additional qualifications like a CCM, MCG certification, like I mentioned earlier, RN-BC, RN case manager, or a CMCN certification in managed care nursing. Blue Cross Blue Shield of South Carolina is hiring a stop loss RN, work from anywhere. This was posted yesterday. It's full time. You have until April 30th to apply. It says right here, remote Jacksonville, Florida. You'll work from 8 a.m. to 4:30 p.m. Eastern Standard Time. This will be fully remote. You need at least a associate's degree in nursing. They require you to have 10 years of experience, 5 years clinical plus 5 years medical management experience, working knowledge of word processing software, that's Microsoft Word. I'm going to skip some of these bullet points. And of course, right here where it says Microsoft Office, and active RN licensure in state hired. And if you have these preferred qualifications like a BSN or 10 years as a medical staff nurse, that would help you. Berkley is hiring a workers' compensation telephonic nurse case manager. You must have 2 years experience in workers' compensation, insurance, and medical case management. That's preferred, not required. They want you to have 4 years med-surg clinical experience. This is required. Exhibit strong communication skills, professionalism, flexibility, and adaptability. Working knowledge of medical and vocational resources available to the workers' compensation industry. And oral and written fluency in both Spanish and English is a plus. So if you're bilingual in Spanish, make sure this is in your resume. And of course, you must have graduated from nursing school, and they also require you to have a compact license, which is actually preferred, not required. And a CCM is preferred, and a BSN is preferred. And the salary for this job is $75,000 to $88,000 per year. This job does mention domestic U.S. travel required up to 10% of the time. If you are fortunate enough to get an interview, I would ask about where you're traveling and how often the travel will be. And this next job is a part-time workers' compensation telephonic nurse case manager role. This job has some of the same exact requirements. You'll work 20 hours per week. You'll work only 4 days per week. The weekdays within standard business hours between 8 a.m. and 5 p.m. And the exact same requirements as the previous job. And just make sure that whenever you are creating your resume, you focus on what you did, why it's important, and how it relates to the job that you want. And this part-time position, the hourly pay is $40 per hour. And it does include domestic U.S. travel up to 10%. And it also includes benefits, health, dental, vision, life, disability, wellness, paid time off, 401k, and profit sharing plans.